Welcome to EMTprep Pulse Check, the podcast where we help you sharpen your knowledge, ace your exams, and stay field ready. Whether you're prepping for the NREMT or looking to stay sharp in the ever-evolving world of EMS, we've got you covered. Each episode brings educational insights, real-world case reviews, and expert tips to boost your confidence, both in the classroom and on the call. Let's jump in.
Today we'll be covering 50 paramedic questions covering the following focus areas: medical and OBGYN, cardiology and resuscitation, trauma, EMS operations, and airway and breathing. Let's get started with our questions brought to you by Jenna, one of our content creators. Question number 1. You are called to an apartment building where a 54-year-old man is complaining of chest pain. You conduct a thorough assessment and sample history. You learn that the chest pain started while the patient was doing kickboxing exercises in his bedroom. The pain subsided after about 5 minutes, and he described the pain as quote-unquote crushing. This patient was most likely experiencing, answers are angina, an acute myocardial infarction, a dysarrhythmia, or congestive heart failure. Correct answer: angina. There is nothing to suggest that this patient is experiencing congestive heart failure or a dysrhythmia. There are 3 main differences between chest pain due to angina and an acute myocardial infarction. First, angina usually occurs following exertion or emotional stress. Second, angina typically lasts between 3 and 8 minutes. And lastly, angina is usually resolved by rest and or nitroglycerin. Patients with angina will often describe the pain as quote-unquote crushing. Next question. You have initiated transcutaneous pacing on a 52-year-old male who has a 3rd-degree heart block. He was initially unresponsive to all stimuli with a pulse of 32, blood pressure 60 over palp, and respirations at 12 per minute. Which of the following is least helpful when determining the effectiveness of pacing? Answers are evidence of electrical capture, increased blood pressure, increased level of consciousness, or evidence of mechanical capture. Correct answer: evidence of electrical capture. When determining the effectiveness of pacing, we always want to look at the patient as a whole. We look for evidence that the pacing is working, such as return of skin color, respirations, the heart responding to the electrical stimuli by manually palpating the pulse. We cannot determine the status of the patient just by looking at the monitor or evidence of electrical capture. Next question. What is the goal of using the drug adenosine? Answers are increase the heart rate, increase the conduction through the AV node, decrease the preload of the blood for the heart, or decrease the conduction through the AV node. Correct answer: decrease the conduction through the AV node. Adenosine decreases conduction at the AV node. It works by causing a heart block at the AV node, which in turn slows the rhythm. Often, adenosine can allow the heart to reset itself in a sense, or at least slow the rate in order for the rhythm to better be identified by a healthcare provider. Question 4. When delivering a shock from a monophasic monitor, what is the recommended joule setting per AHA guidelines? Answers are 200 joules, 360 joules, 100 joules, or 300 joules. Correct answer: 360 joules. The AHA recommends a joule setting of 360 when using a monophasic monitor. They recommend the same dose for all subsequent shocks as well. Question 5. The amount of blood ejected by the heart every minute is known as cardiac output. What are the 2 components of cardiac output? Answers are heart rate and heart rhythm, heart rate and blood pressure, heart rate and stroke volume, or heart rate and percentage of ventricular contraction. Answer is heart rate and stroke volume. Cardiac output is calculated by multiplying the heart rate by the stroke volume, which is the amount of blood ejected per contraction of the heart. Next question. On an EKG strip, what does the QRS complex represent, and what is its normal duration? Answers are atrial repolarization, 0.12 seconds, ventricular repolarization, greater than 0.12 seconds, ventricular depolarization, greater than 0.12 seconds, or ventricular depolarization, less than 0.12 seconds. Correct answer, ventricular depolarization, less than 0.12 seconds. The QRS complex is a narrow complex, usually less than or equal to 3 small boxes in length, or 0.12 seconds. The complex indicates ventricular depolarization. Conduction starts at the AV junction through the bundle of His, left and right bundles, and the Purkinje system. Question 7. You have a patient with chronic AFib and notice she is taking the blood thinner, warfarin, along with a calcium channel blocker. The purpose of the blood thinner being included in chronic AFib maintenance is? Answers are preventative of embolotic stroke, prevention of pulmonary embolism, prevention of hemorrhagic stroke, or prevention of a DVT. Correct answer, prevention of an embolotic stroke. Anticoagulants are prescribed for chronic AFib because the lack of atrial kick leads to the atria recirculating blood and eventually clotting and exiting the heart. This can lead to the embolus traveling directly to the brain and causing a stroke. Next question. You are called to a residence for a 41-year-old male experiencing respiratory distress. On arrival, your patient's wife states he has been anxious and agitated this morning and got lightheaded upon standing. You instruct your partner to take vitals and attach the patient to the ECG monitor while you administer oxygen to the patient via a non-rebreather at 15 liters a minute. Your partner reports the following vitals: blood pressure 82/50, heart rate of 190, SpO2 at 90%, and SVT on the monitor. The first priority for this patient is? Answers are vagal maneuvers, 12-lead EKG to rule out more life-threatening dysrhythmias, synchronized cardioversion, or 5 milligrams midazolam or Versed given IV. Correct answer, synchronized cardioversion. The main thing to consider with this question is whether the patient is stable or unstable. With hypotension, respiratory distress, and SVT, this patient is very unstable. We are past the point of vagal maneuvers, and giving a sedative may delay what this patient needs most. This SVT is a very life-threatening dysrhythmia that needs synchronized cardioversion immediately. Question 9. You are treating a patient complaining of a crushing chest pain whose 12 lead shows sinus tachycardia, ST elevation in various leads, and a left bundle branch block. What is true of ST elevation and bundle branch blocks? Answers are: if the patient has a history of the bundle branch block, it is not concerning. A left bundle branch block masks normal interpretation of a STEMI. A right bundle branch block masks normal interpretation of a STEMI. Or bundle branch blocks, though concerning, do not affect a STEMI diagnosis. Correct answer: a left bundle branch block masks normal interpretation of a STEMI. Left bundle branch blocks can mask or mimic the EKG changes commonly seen with an acute myocardial infarction. Normal criteria can still be used to diagnose a STEMI in the presence of a right bundle branch block. If there is any sort of blockage in the electrical conduction system of the heart, the patient's risk of suffering a negative event increases. Question 10. You respond to a call for an unconscious male who bystanders watch collapse at a local park. You arrive, to find bystanders performing CPR on a young, approximately 20-year-old male. You confirm the patient actually has a palpable and rapid carotid pulse. You place a 4-lead EKG onto the patient while your crew begins to assess the patient's A, B's, and C's. Your partner tells you to check the rhythm that shows on the monitor, in which you interpret the rhythm as polymorphic ventricular tachycardia. You attempt to synchronize the rhythm to perform cardioversion. However, it faults and is unable to accurately synchronize. What do you do? Answers are: establish an IV and administer magnesium sulfate, contact OLMC, perform defibrillation, or establish IV and administer amiodarone. Correct answer: perform defibrillation. The patient is in an unstable tachycardia, which is likely the cause for his sudden loss of consciousness. This unstable dysrhythmia must be quickly managed as your crew continues to perform A, B's, and C's. For polymorphic ventricular tachycardia, or torsades, with a pulse, the correct route for treating an unstable patient is electricity. However, sometimes with torsades, the manual defibrillator may struggle to sink into this rhythm due to its significant irregularity. If synchronized cardioversion is unable to be completed, attempt to deliver an unsynchronized shock, i.e. defibrillation, instead. Question 11. There are how many thoracic vertebrae in the spinal column? Answers are 5, 12, 9, or 7. Correct answer: 12. There are 12 vertebrae that compose the thoracic area of the spine. This is what makes up a majority of the back. Next question. Anapsine is not considered to be which of the following classes of drugs? Neuroleptic, antihypertensive, antiemetic, or sedative? Correct answer: antihypertensive. Anapsine is typically indicated for chemical restraint and nausea vomiting in EMS. Question 13. A call is made for a 41-year-old woman with severe abdominal pain. Upon arrival, she tells you that the pain occurred suddenly while she was watching TV. Palpation of the right upper quadrant causes her to cry out in pain, and she tells you that she initially felt the pain right below her sternum, and it radiated to the right side of her abdomen. You note that her skin feels warm. What is the most likely cause of this? Answers are pancreatitis, indigestion, cholecystitis, or hernia. Answer is cholecystitis. With the signs and symptoms described, cholecystitis is the most likely cause of the patient's condition. While the description of pancreatitis is similar, there are differing symptoms, such as pain originating from the umbilicus, which radiates through the back and shoulders. A hernia is almost always from a sudden and strenuous physical activity. Finally, indigestion does not usually involve sudden and severe pain. Next question. You are on scene for a possible overdose. You find your patient unresponsive, and you notice needles near your patient's arm. The mother states he has a history of heroin abuse. You administer 0.4 milligrams of Narcan. After 15 minutes, your patient is conscious, alert, and oriented ×4 with a GCS of 15. Narcan was the appropriate treatment for this patient because it is a what? Answers are opioid antagonist, opioid blocker, opioid cell blocker, or an opioid agonist. Correct answer: opioid antagonist. Narcan is an opioid antagonist, a drug that attaches to a receptor but does not stimulate a response is called an antagonist. In this case, Narcan attaches to the brain's opioid receptors and it blocks the effects of heroin. Question 15. You have a 61-year-old female complaining of a headache, vomiting, and dizziness. She recently began using a new gas heater to warm up the house. The patient appears to be sleepy, and her vital signs are blood pressure 164/86, heart rate of 104, respiratory rate 18, and SpO2 99%. Her sister states they ate dinner together a few hours earlier and she felt fine. This patient's condition suggests answers are hypoglycemia, stroke, carbon monoxide poisoning, or food poisoning. Correct answer, carbon monoxide poisoning. The new gas heater, the signs and symptoms, and the high SpO2 reading should lead you to suspect carbon monoxide poisoning. Most patients will present with dizziness and appear to be sleepy. The pulse oximetry can be misleading because CO binds easily to hemoglobin, giving that false high reading. Next question. You have been dispatched for an attempted suicide. Police have indicated that the scene is safe and you can enter the residence. Your patient is a 19-year-old female who took some of her grandma's depression medication. The prescription was for nortriptyline, which was recently filled and is now empty. Your patient's mental status is deteriorating, and a forelead shows widening QRS complexes. What medication should you consider to counteract the suspected TCA overdose? Answers are sodium bicarb, activated charcoal, glucagon, or calcium gluconate. Correct answer, sodium bicarbonate. The sodium bicarbonate will work to counteract the metabolic acidosis that is created by the toxic levels of tricyclic antidepressants in the body. Question 17. Which endocrine gland is primarily active in childhood, but function reduces dramatically in adulthood? Answers are parathyroid gland, thyroid gland, pineal gland, or the thymus gland. Correct answer, thymus gland. The thymus is an endocrine gland responsible for the release of thymosin, which stimulates the creation of T lymphocytes. Next question. You are dispatched to a private residence for an unconscious 65-year-old male. On arrival, his wife tells you that her husband was complaining of having the quote-unquote the worst headache of his life after he woke up. Within an hour of waking up, he had passed out while sitting at the dining room table. Your patient is currently unconscious and unresponsive, with irregular snoring respirations, followed by brief periods of apnea. The patient has a history of hypertension and AFib. Vital signs are as follows. Blood pressure 170/108, heart rate 66, SpO2 91%. What do you think your patient is experiencing? Answers are ischemic stroke, migraine, hemorrhagic stroke, or TIA. Correct answer, hemorrhagic. Hemorrhagic stroke is characterized by a sudden onset of symptoms including coma. These patients may complain of experiencing the worst headache of their life prior to the onset of symptoms. History of hypertension is common in patients who experience hemorrhagic stroke. Next question. Your patient is attempting to stimulate an 8-month-old baby boy who was found in respiratory distress. The baby opens his eyes when you call out its name. However, it's only in between inconsolable crying. The baby appears to be moving normally. What is the baby's GCS score? Answers are 12, 14, 13, or 10. Correct answer, 12. Eyes are a 3, verbal is a 3, motor is a 6, for a total of 12. Question 20. You have just intubated a patient with altered mental status due to an inability to protect his airway. Prior to intubation, the patient had rapid breathing, pulmonary edema, and slight hypoxia. You suspect the patient's current condition is the result of a UTI that has been progressing in severity over the last week. What do you expect the patient's end-tidal CO2 to be when you confirm the placement of your tube? Correct answers are decreased, less than 35 millimeters of mercury, elevated, greater than 45 millimeters of mercury, normal, 35 to 45 millimeters of mercury, or absent. Correct answer, decreased, less than 35 millimeters of mercury. There is a lot of information provided in this question, so we need to decipher what is being asked. Key points include tachypnea prior to intubation and a suspected infection that has progressed over the last week. With this, we can surmise that the patient is experiencing metabolic acidosis and is progressing towards sepsis. The patient is likely breathing rapidly in an attempt to blow off excess levels of CO2 and lower the end-tidal CO2. Next question. You respond to the residence of an unconscious and apneic elderly male. You find advance directives on the counter stating that he does not wish to be resuscitated, but a physician has not signed it. What should you do? Answers are begin resuscitation, use basic resuscitation procedures only, delay resuscitation as you contact the family or online medical control, or discontinue resuscitation. Correct answer, begin resuscitation. These cases are tricky. If there is confusion, always start resuscitation until online medical control can be contacted or the appropriate documents can be located. Note that there is no such thing as a basic resuscitation. Next question. Your ambulance is in the first arriving unit on the scene of a two-car motor vehicle collision blocking the far right lane of traffic on the interstate. Where should you position your ambulance? To the right and behind the incident? To the left of the incident? Behind the incident? Or in front of the incident? Correct answer, behind the incident. Your main goal in placing your ambulance is scene protection and should be accomplished by positioning your ambulance directly behind the incident. Question 23. Which of the following is not a component of the scene size-up? Answers are general impression of the patient, transport decision, consideration of need for additional resources, or mechanism of injury. Correct answer, transport decision. The transport decision is made following the checking of circulation, airway, and breathing. Next question. The quote-unquote clean zone at a hazardous material incident is also referred to as the what? Answers are hot zone, warm zone, clear zone, or cold zone. Correct answer, cold zone. The cold zone or clean zone is an area where adequate decontamination has ensured that there will be no spread of any hazardous materials and EMS are able to fully treat patients. Next question. Which of the following is false regarding a landing zone for a medical helicopter? Answers are a slope of less than 30 degrees is acceptable for a landing zone. Power lines in close vicinity to the landing zone are not acceptable. All trash, rocks, and other small debris should be removed. And the landing zone should be at least 100 feet by 100 feet. Correct answer, a slope of less than 30 degrees is acceptable for a landing zone. The slope of the surface that the landing zone encompasses should be no more than 10 degrees. Next question. You are responding with lights and sirens on a 3-lane highway that has a middle lane for traffic to make turns into businesses along the route. One of the vehicles along the route made a sudden turn into the middle turn-only lane before you make your way by. How should you proceed? Answers are pull around the vehicle to the left on the other side of the highway, stop and wait for the vehicle to pull to the right, pull close behind the vehicle until it moves completely to the right, or pass the vehicle on the right and continue on? Correct answer: stop and wait for the vehicle to pull to the right. Always pass all vehicles to the left in the safest manner possible. Pulling onto the other side of the highway will compromise a safe distance on all sides. The correct way to proceed is allowing the vehicle to pull off to the right and then proceeding by. Next question. You respond to a report of a 47-year-old woman with chest pain. As you are performing the assessment, her 54-year-old husband enters the room. He is angry and appears intoxicated. The woman warns you that her husband can be violent when he is drinking. The husband threatens you to leave or he will physically remove you. What should you do? Answers are: leave the patient, retreat to the ambulance and call for help, physically confront the husband, only leave the house if you can bring the patient with you, or stay inside with the patient until the police arrive. Correct answer: leave the patient, retreat to the ambulance, and call for help. The best response is to retreat from danger, even if you need to leave the patient. You should find a safe place, such as the ambulance, and wait for police. You should never confront the dangerous person. Next question. You have been dispatched to a terrorist attack at the county courthouse. Upon your arrival, the hazmat team informs you that someone used mustard gas inside the courthouse and quickly identifies the type of injuries that you should expect your patients to have. Mustard gas is what type of agent? Answers are nerve, pulmonary, biologic, or vesicant. Correct answer: vesicant. Mustard gas is a vesicant, also known as blister agent. There is no antidote, so be prepared to provide supportive care and airway management. Next question. When performing rapid triage via the START method, what 3 criteria are you assessing? Answers are motor, verbal eyes, scene safety, C-spine, major bleeding, airway, breathing, circulation, or respirations, perfusion, and mental status. Correct answer: respirations, perfusion, and mental status. Triage is the quick assessment of a patient's respiratory, perfusion, and mental status. The main goal is to prioritize patients needing the greatest level of care when there are limited resources. Question 30. Which of the following patients can refuse care? A 20-year-old male involved in MVC with no visible injuries, not oriented to person. An 82-year-old male, conscious, alert, and oriented, with visible deformity to his lower leg. A 41-year-old intoxicated female who fell down the stairs. And a 12-year-old female with a minor head laceration due to a bicycle accident. Correct answer: 82-year-old male, conscious, alert, and oriented, with visible deformity to his lower leg. There is no doubt that this patient needs to be evaluated and treated, but he has every right to refuse your services. Minors, intoxicated patients, and altered patients cannot refuse. Next question. You are dispatched to a house fire where a 19-year-old male has been burned. He doesn't complain of pain and has dry, leathered skin that appears white and charred. This type of burn can be classified as superficial, partial thickness, medium thickness, or full thickness. Correct answer: full thickness. Dry, leathery, white, charred skin is characteristic of a full thickness burn. All the nerve endings have been damaged, and as a result, he presents with no pain. Next question. What is the Parkland burn formula for fluid replacement in burn victims? Answers are BSA times 4 milliliters times kilograms body weight, 4 milliliters times kilograms body weight, BSA times 2 milliliters times kilograms body weight, or body surface area times kilograms in body weight. Correct answer? BSA times 4 milliliters times kilograms of body weight. The correct Parkland-Burn formula is BSA times 4 milliliters times body weight in kilograms. This gives you the total amount over a 24-hour period. Question 33. Your patient is an 18-year-old male who was slashed across the abdomen with a machete. He has a mass of omentum and a small bowel protruding from the wound. Which of the following is your primary concern with this patient? Answers are: immediately covering the wound with an occlusive dressing, covering the wound with a sterile, saline moistened dressing covered by an occlusive dressing, irrigating the exposed organs with sterile saline to remove debris and gently tucking them back into the hole, or ensuring an open airway by anticipating vomiting, providing oxygen, keeping the patient warm, monitoring, and treating for shock. Correct answer: ensuring an open airway by anticipating vomiting, providing oxygen, keeping the patient warm, monitoring, and treating for shock. First, we must ask ourselves, is this an immediate life threat? As of now, the answer is no, but it could very quickly turn into one. We must ensure that this patient does not go into shock by treating him accordingly. Oxygen administration, keeping him warm, and monitor accordingly. Never tuck the organs back into the body. They are contaminated, and if you push them back in, you could contaminate the inside of the body and cause further problems. Next question. You are on scene at a college soccer field. Your patient is a 22-year-old male who was kicked in the head while attempting to head the ball into the goal. He is disoriented, confused, and has weakness in his right extremities. Examination of his head finds swelling above and behind his left ear. Your patient also has a left blown pupil. Your patient's symptoms suggest what injury? Concussion, stroke, unical herniation, or seizure? Correct answer: unical herniation. The blown pupil with contralateral weakness is indicative of unical herniation. This occurs when sudden force is applied to the temporal region. As the brain swells, it pushes the temporal lobe closer to the center of the brain, which causes contact with the oculomotor nerve and other structures. This abnormal contact causes dilation of the pupil on the side that the herniation is happening on. Question 35. Your 7-year-old patient has a nail impaled in the bottom of his foot. What should you do? Answers are: assist the patient to a parent or guardian's car and ensure they are transported to the hospital. Remove the nail, treat for bleeding, and transport to the hospital for treatment. Apply bulky dressings around the nail and transport the patient to the hospital. Remove the nail, dress the wound, and provide appropriate cleaning instructions to the parents. Correct answer: apply bulky dressing around the nail and transport the patient to the hospital. Removal of an impaled object in the field can cause further damage, including an uncontrollable flow of blood. Dress the wound with bulky dressings to prevent the nail from shifting and causing further injury or pain. The patient should not be transported by private vehicle because of the inability to control the nail. Question 36. You arrive at a sheet metal factory to find a 24-year-old male surrounded by towels drenched in blood with a deep laceration to his left forearm. Bright red blood is spurting from the wound. In his coworkers report, the patient was lifting a large piece of metal when it slipped and cut him. Your patient is semi-conscious, so you apply direct pressure to his wound and direct your partner to take vitals. Your partner reports the following: blood pressure is 68 over palp, heart rate of 130, respiration 17, saturations at 92%. Of the following, which treatment would this patient most benefit from? Correct answer. Applying more dressings to prevent further blood loss. Trendelenburg's position to direct blood back to the heart. Large bore IVs and fluid to increase the blood pressure. Or vasopressor to elevate the blood pressure. Correct answer. Large bore IVs and fluid to increase the blood pressure. Dopamine is contraindicated when fluid resuscitation has not taken place. The bleeding is controlled, and applying further dressing to the wound is not a priority. It is important to infuse fluid into this patient, trying to maintain a blood pressure from 90 to 100 millimeters of mercury systolic. Next question. What is the most important factor in survivability outcomes from cardiac arrest secondary to a drowning incident? Answers are immediate high-quality CPR, high-quality ventilation, suctioning of an airway, or an advanced airway. Correct answer, immediate high-quality CPR. Immediate high-quality CPR is the most important factor in survivable outcomes from cardiac arrest secondary to a drowning incident. It is even necessary to start CPR in the water if the situation allows with the right equipment. Next question. You are assessing a 30-year-old mechanic with a crush injury after a vehicle collapsed on his left leg in the shop. Adequate cellular respiration is a concern regarding crush injuries. In this scenario, what medication should be considered in a crush injury relating to cellular respiration? Answers are glucagon, dextrose, sodium bicarbonate, or dopamine. Correct answer, sodium bicarbonate. Sodium bicarbonate counteracts acidosis that will negatively affect the kidneys' increased uric and lactic acid from decreased cellular respiration. Cardiac dysrhythmias are also a concern because of the electrolyte imbalances that may arise as a result of fluid loss. Use caution when treating these patients, and be aware that online medical control may be necessary to obtain medication orders depending on local protocols. Question 39. You respond to the scene of a serious car accident where the patient is suffering from head trauma. She has a dramatic discoloration around her eyes. She is most likely suffering from what? Answers are avulsion, cerebral contusion, intracranial hemorrhage, or basilar skull fracture. Correct answer, basilar skull fracture. A basilar skull fracture is a cranial injury that often presents with quote-unquote raccoon eyes. An avulsion is a type of scalp wound. Cerebral contusions and intracranial hemorrhages are focal injuries that present with neurological signs and symptoms. Next question. After staging your ambulance, police determine that it is safe to enter the scene. You arrive to find a 19-year-old male with a gunshot wound to the chest. How should this patient be treated? Answers are occlusive dressing over the wound, sterile gauze and direct pressure, high flow oxygen and rapid transport, or chest decompression. Correct answer, occlusive dressing over the wound. When a hole is created in the chest, air can enter into the pleural space. If left untreated, this can develop into a tension pneumothorax. Our goal by placing an occlusive dressing is to allow air to move out of the space but not go in. Question 41. After decompressing your 68-year-old septic female's patient's chest, her blood pressure rises, anxiety decreases, and her saturation levels improve. After 3 minutes, the patient becomes hypotensive again, with decreasing saturations and increased anxiety. You note that the decompression catheter appears to be clogged with mucus-like secretions. What should your next course of action be? Answers are decompress the other side of the patient's chest, continue code 3 to the hospital and support ventilations with a BVM, remove the clogged catheter, clean it out, and attempt reinsertion, or re-decompress the patient's chest? Correct answer, re-decompress the patient's chest. If a patient's decompression catheter becomes clogged, re-decompress their chest. It was effective the first time for this patient, and it will work again. It is not uncommon for these patients to have their chests decompressed multiple times. Question 42. You are dispatched emergent to a call for difficulty breathing. Your patient is a 22-year-old female that has no medical history and no allergies. Her only medication is birth control. Breath sounds are normal, and she is showing signs of JVD. Vitals are within normal limits, leading you to suspect what? Answers are pulmonary embolism, ectopic pregnancy, pericardial tamponade, or tension pneumothorax. Correct answer, pulmonary embolism. Young women on birth control are susceptible to blood clots, which can increase risk for a pulmonary embolism. Next question. What minute volume is needed to maintain sufficient gas exchange in a healthy person at baseline? Answers are 4 liters a minute, 5 liters a minute, 6 liters a minute, or 7 liters a minute. Correct answer, 7 liters a minute. Minute volume is the volume of gas inhaled and exhaled from a person's lungs in 1 minute. Trauma patients with abnormal respiratory rates or inadequate ventilation can very easily dip below the needed minute volume. Next question. A decreased pH, increased PCO2 level, and elevated HCO3 level indicates which of the following acid-base derangements? Answers are metabolic alkalosis, metabolic acidosis, respiratory acidosis, or respiratory alkalosis. Correct answer, respiratory acidosis. The decreased pH with an elevated PCO2 indicates that the patient is retaining CO2 as a result of respiratory acidosis, in which the respiratory system is not properly buffering. The kidneys will start to try and compensate the acidic state by raising HCO3 levels if the respiratory acidosis lasts for a significant period of time. Question 45. You respond to a 3-year-old female in respiratory distress. When you arrive, you find your patient sitting on her mother's lap. She is working hard to breathe, and you note mild stridor with drool coming from her mouth. Her mother tells you that her daughter has had a fever and cold-like symptoms for a couple of days, but this afternoon her condition worsened. The patient has a pulse of 140, respiratory rate of 42, and blood pressure 88/50. Which of the following is the child most likely suffering from? Answers are pneumonia, epiglottitis, RSV, or upper airway obstruction. Correct answer, epiglottitis. Epiglottitis commonly has difficulty breathing, history of recent illness, stridor, and drooling as symptoms. Next question. The Selleck maneuver helps to do which of the following? Answers are help providers detect peritonitis, bring the vocal cords into view, allow providers to move an obese patient in a tight space, or bring a foreign body airway obstruction into view when using Miguel forceps. Correct answer, bring the vocal cords into view. The Selleck maneuver, or cricoid pressure, serves 2 purposes during an intubation attempt. It helps to prevent regurgitation of gastric contents, and it helps bring the vocal cords into view. Question 47. Why is BiPAP preferred over CPAP in asthma and COPD patients? Answers are BiPAP allows the patient to exhale against a lower pressure, helping improve ventilation efforts. BiPAP is preferred because it maintains continuous positive airway pressure. BiPAP is not preferred and should not be used. And BiPAP allows for the use of duo-neb in conjunction with BiPAP. Correct answer. BiPAP allows the patient to exhale against a lower pressure, helping improve ventilation efforts. BiPAP, also known as bi-level positive airway pressure, provides two pressures, one during inspiration and one during expiration. Because asthma and COPD are air trapping conditions, lowering the pressure against which a patient has to exhale can help improve ventilation and gas exchange. Next question. Severe respiratory distress often requires immediate therapeutic interventions. Epinephrine would not be appropriate in which of the following? Severe asthma, true anaphylaxis, severe emphysema, or severe allergic reaction? Correct answer, severe emphysema. Epinephrine is indicated in severe allergic reactions, anaphylaxis, and severe asthma. Epinephrine is not indicated in the treatment of COPD, including emphysema. Question 49. What abnormal breathing sound has characteristics of loud, low, coarse sounds that resemble snoring and often clear with coughing? Answers are rales, stridor, wheezes, or rhonchi. Correct answer, rhonchi. Rhonchi are breathing sounds that are indicative of an airway obstruction. A generalized obstruction is due to conditions such as asthma or COPD, while a localized obstruction is due to a tumor, mucus, or foreign body. In question 50, you have responded with the battalion chief to a semi versus car. Upon arriving on scene, the battalion chief tells you to assess any patients, and he begins to call for additional resources. The truck driver is uninjured but shaken. The driver of the car is unresponsive, has a weak carotid pulse, and is apneic. An object penetrated the driver's right bicep, and you notice blood spurting from the wound. You apply direct pressure with both hands, and you are able to stop the bleeding. The battalion chief has come over and wants to know what they can help you with. What should you direct them to do? Answers are: apply a tourniquet, start an IV and begin fluid resuscitation, manually open the airway using a jaw thrust maneuver, measure for and apply an appropriate size C-collar. Correct answer: manually open the airway using a jaw thrust maneuver. Your patient is unconscious, which means you should address life threats using CAB. You have stopped the patient's life-threatening bleeding and have determined the patient has a pulse. The next apparent life threat that needs to be addressed is the patient's airway. You should have the battalion chief open the airway using the jaw thrust maneuver.
Thanks for tuning in to EMTprep Pulse Check. If you found today's episode helpful, be sure to subscribe, leave a review, and share it with your classmates and crew. For more test prep tools, study guides, and practice exams, head over to EMTprep.com. Until next time, stay sharp, stay safe, and stay on pulse.